Okay, welcome everybody. We're just gonna take 30 seconds to let everyone in the room, and then we will get started with our webinar and presentation today. Thank you for attending. Okay, a few more just coming in. So we'll go ahead and get started. Welcome to the Bastyr University Doctor of Naturopathic Medicine and Virtual Information Session. Today, my name is Terrence Peterson. I am the Enrollment Advisor at Bastyr University, San Diego. I am also accompanied today by my director, Mark Thompson, and then also to Dr. Christina Connor. Really appreciate having all of you here. So we're going to go ahead and get started with a few housekeeping uh, things that we want to pay attention to. First of all, we're going to have a presentation by the good Dr. Connor today uh, about the naturopathic medicine program. After that, there's an admissions portion that'll be presented by me. And then at the end, we'll open up the floor for question and answer. I believe we have a chat function that if you would like to get your questions answered during the presentation, I will be manning that and taking care of that. So feel free to ask your questions during the presentation. If they're more specific for Dr. Connor, I'll save those towards the tail end and let her go ahead and get started with that. So before I let the good doctor speak, let me just give you a little bit of her background. Dr. Christina Connor has served as the Dean of the School of Naturopathic Medicine at Bastyr University since July 2021. She is a licensed naturopathic physician and acupuncturist. She brings over 2 decades of leadership in integrative medicine to her role. She is a 2001 graduate of Bastyr University. She completed her residency in family and integrative medicine at the University of Bridgeport, and she later completed her Master's of Science in Oriental Medicine at the University of Health Sciences. She practiced in Connecticut, Indiana, and Illinois, and she combined clinical care with advocacy for expanded access to natural medicine. She is a founding faculty member for the ND program at National University of Health Sciences. She taught there for 15 years, serving 3 years as the clinical science department chair. During her tenure, she also held national and state leadership roles, including the president of the Illinois Association of the Naturopathic Physicians. Dr. Connor's holistic philosophy prioritizes the body's innate healing capacity through least invasive interventions, ranging from nutrition, lifestyle counseling, to targeted use of pharmaceuticals when necessary, and underscores the importance of balancing mind, body, and spirit with personalized care. Dr. Connor, thank you for your presentation today. I'll be manning the slides, so just let me know when you'd like to move through, and you have the floor.
Yeah, thanks. Thanks, Terrence. So welcome everyone, and I'm glad to see so many people on the webinar. Um, yeah, feel free to ask questions as I go through. I'll try to pause at uh, specific times if there are questions, or towards the end of when I'm going to be speaking tonight. Um, but welcome. So we'll start with what naturopathic medicine is. So the next slide, please. And we'll talk just a little bit about what makes us really unique. And I would say, of all of the principles, which I'm going to list a little bit more on the next slide, but um, What really makes us unique is this vis medicatrix naturae. You'll often hear it referred to as the vis for short. But what the idea here is really that we're trying to restore health by using your own body's ability to heal. So we know that we all have this. We have an innate ability to heal. You cut your hand and it eventually heals, right? So we use this property that is inherent throughout all of nature and basically exploit it. To, as a naturopathic doctor, you get familiar with how you enhance the body's ability to heal and how you remove the obstacles to someone being able to heal themselves. And so that is really the thing that definitely sets us apart from other practitioners. You'll see as we go through some of the things like the therapies, there is overlap with other professions. What makes us unique as naturopathic physicians is the way that we put all of those things together. And the VIS is really kind of the leading principle here. So um, naturopathy itself, the practice of naturopathic medicine, is both nature cure and more recently combined with more modern approaches to healthcare. So if you look at nature cure philosophy, the turn of the last century and into the early part of the last century, that's when naturopathy was probably better known, because a lot of those therapies such as homeopathy, manipulation, and some of our other natural therapies were really getting started during that time and were very widely used. So in a lot of ways, naturopathic medicine is returning to our roots as well in the way that medicine was used not that long ago, but it seems like a really long time ago because our predominant model has been so overwhelming throughout Western society. Um, so, next slide, please. And this is going to have the other principles that we talk about. So, if you've read pretty much anything about naturopathic medicine, hopefully you're already at least a little familiar with this. Um, the vis medicatrix naturae is the first one, and like I said, is really the one that sets us apart from most other professions. The rest of these, I gave you the Latin as well as the English translation. Um, but these are ones that might be familiar to you, especially if you have been involved or are familiar with other philosophies of health too, because there's overlap with some of those other professions too. So we definitely try to treat the cause, for instance, first do no harm, which is a tenet really of all medicine. Um, Doctor is teacher, and this is something that is also a little more unique to the naturopathic profession, treating the whole person, and prevention. So, all of these are really the cornerstones of naturopathic philosophy and the way that we approach health and the way that we approach patient care. Next one, please. So, I mentioned here the vis medicatrix naturae as being really central. And this really goes back to Paracelsus and early philosophers about how the body works and about medicine. And this is our primary goal. It is really to support, to facilitate, and to augment the natural process that we all have inside ourselves to recover and heal. Next one. Now, the way that we put this together, the principles are kind of the cornerstones and the foundation. The therapeutic order is the way that it gets put together. So we visualize this as a pyramid, which is the base of this is establishing the foundations for health. And this is really the very important part of what we do with every single patient. And think about this as not necessarily just additive, but it is adaptable for different stages, for different conditions, and to the individual patient too. So we always try to establish the foundation for health. So even if someone was coming in for, say, a higher force intervention, you're still going to look at those things that are disturbing their health in the first place and try to make as many positive changes there. And a lot of that is in establishing a very healthful regime, in what is often referred to now as lifestyle medicine, which is a term that's been picked up by other professions, but really it is at the root of everything that a naturopathic physician does, and it always has been. But establishing those foundations for health is really a very important part of what we do. And in some ways, that may seem very simplistic because you tell patients over and over again that they need to get more rest and reduce their stress and drink more water and eat healthy food. But these are the things that underlie all healthy people. When you look throughout the whole world, if anyone's heard of the blue zones ideas. The blue zones often take into account all of these factors in a foundation for health, such as not only the diet you eat, but the lifestyle you live. And that really is very essential to what we do. So we spend a lot of time talking with patients, educating patients. The docere principle comes into a large part of uh, helping people understand why they need to establish and maintain that foundation for health. And that becomes a large part of what we do. Now, the next thing is stimulating the vis medicatrix naturae. So the first part is kind of removing those obstacles that will prevent someone from healing. And then the next part is stimulating the body's ability to heal. So we use a number of different therapies here. And actually, there's a lot of therapies that can be used on a more energetic level, even if they have a, kind of physical or solid form. So for instance, I like to give the example of herbal medicines. You can take herbal medicines for several different ways according to our naturopathic therapeutic order. You can address pathology with a natural substance, you can tonify a system with a natural substance like an herbal, but you can also use herbals to stimulate your own ability to heal. And that might be, if you're familiar with something like a flower essence or a cell salt, those are often our therapies stimulating the body to heal as well as providing some kind of higher level intervention at the same time. The third step in the therapeutic order is tonifying a weakened system. And this is very individual for the person or sometimes for the condition. Many of you probably recognize, if you think about your own health, maybe you've always had an issue with XYZ. So, for me, for instance, I had allergies when I was a kid. So, I always had a lot of respiratory allergies when I was younger. That was kind of my weak system. Um, Whereas many of my other systems, my digestive system was fine, my musculoskeletal system was fine as a kid. I didn't have a lot of issues in that area, but I always had a lot of respiratory and skin allergies. And so for me, that's my weak system. I know that I have to kind of continually pay attention to it. I have to kind of baby it a little bit more than maybe some other parts of my health. And, that's everyone probably can recognize for yourselves that you might have a system that needs to be tonified a little bit more than others. Structural integrity is another one too. So we place a large emphasis on making sure that the body is strong and able to not only adapt to your everyday needs, but adapt to any kind of health challenges that you might have. So, correcting structural integrity, tonifying the musculoskeletal system is step 4. The fifth one is addressing pathology using natural substances. Now, when a lot of people find out about naturopathic medicine, this is automatically they think what we do. and all of what we do. And it certainly is a part of what we do, but it is not the only part of it. And it's not even the starting place for a lot of naturopathic physicians. But this would be using, say, a herbal medicine or a supplement instead of a medication like we are more accustomed to in kind of conventional medicine. So instead of an aspirin, you might take willow bark, or you might take an anti inflammatory like curcumin or turmeric. Um, so that would be some examples of using a natural substance. We certainly do that as a part of many patients' treatment, but that is not all of what we do. So we're not simply just dispensing a natural substance instead of a pharmaceutical. Um, we really do kind of move all over this therapeutic order pyramid. Number six is addressing pathology using a pharmacological or a synthetic substance. And then the seventh one is suppressing or surgically, something like surgery, a higher force intervention or injection therapies. They would be considered more of that higher level, um, level seven. So, like I said, we kind of move up and down this pyramid. It's very adjustable for the patient. Um, the approach that we take with the patient is always individualized, but what we emphasize is trying to use the least force necessary. So if we can accomplish something by working in, kind of level 1, level 2, level 3, sometimes we don't need to go to level 6 or 7. Um, there are some times when that's appropriate. Obviously, if you break a bone, you want somebody to set the bone. You don't just want to let it heal on its own most of the time. Um, you might need a higher force intervention at that point. Or if you had a major illness or injury. And a lot of times for people, it is a combination of these different things. They're not exclusive. So even though you may require a medication, whether that's short term or long term, we would also still be looking at establishing the basis for your health, tonifying your weakened systems, stimulating the V's. We would be looking at all of these things as well. So that's the approach in naturopathic medicine, and that is the way that we really start helping move people towards a higher state of health. Next one, please. Next slide. All right. So now we'll talk a little bit about the modalities. And the reason why I wanted to talk about the philosophy first is because it's easy to get sometimes kind of fixated on the modalities and like what can and can I do as a naturopathic physician. But it's really more important to think about the philosophy first because the modalities oftentimes you'll naturally be led to a certain modality depending on what level you're talking about. So I mentioned botanical medicine. Botanical medicine a lot of times is just either correcting pathology or sometimes tonifying a weakened system, but you can use it, kind of in a lower level, lower force intervention way too. Um, we have a lot of different modalities, and the reason why you don't want to get too fixated on those is that depending on where you are in the country, and I'll talk a little more about that in a minute, you may or may not be able to use a lot of these therapies um, yourself without necessarily working with another physician or another provider. So, for instance, the two things that are starred here, pharmaceuticals and minor office procedures, we don't have the ability as naturopathic physicians to always use those, even in states where we're regulated. We can generally use things like nutrition, nutritional supplements, homeopathy, lifestyle changes, um, in pretty much all places where one can practice, either as a naturopathic physician or a naturopathic practitioner. Um, But you can't always use pharmaceuticals. It might not be within your scope of practice depending on where you go. That does not mean that you are not practicing naturopathic medicine. Because we're so adaptable, like I said, kind of up and down that therapeutic pyramid, as well as within our modalities, you can almost always help someone, even in places where you may not have a really wide scope of practice. So as Terrence mentioned in my bio, I practice mostly in unlicensed states where we were not yet regulated. However, there's lots of things that you can still do as a naturopathic physician, even in places where we're not regulated. Um, because you have so many tools to draw from and so many different places that you can work on a patient's health with them. So if you look at all of these, you will likely be drawn to one or maybe several of the modalities, and that's okay as well. We don't expect that everybody is going to master every single modality and become an expert in all of them, but we do include all of these as part of your education and training as a naturopathic physician to be. Next slide, please. So this is a little more on the regulation piece. So there's the training and the practice, but then there's also, the way that you might be envisioning what your future practice looks like as a naturopathic doctor. Um, Currently, the green states here are where we're regulated, the green states and provinces and territories too, so like Puerto Rico. So there is licensing or registration laws for naturopathic doctors in all of those areas. The purple areas are the ones that are kind of under development, so places where we are likely to be regulated in the near future, but where we're not currently. And the gray area right now is kind of further less along in their development of regulating naturopathic physicians. NDs graduate from accredited four-year schools, and which ours is considered one of these residential naturopathic medicine programs. We do pass licensing examinations. We call them NPLEX, and that's similar to your USMLE. If you're, in allopathic medical school, we have licensing exams as well. And that allows us to be licensed in the jurisdictions where you can be. The scope of practice, as I already mentioned, does vary among the states. And so if you are really interested in kind of digging down into the details more, we would recommend the American Association of Naturopathic Physicians as a place for viewing where the scope of practice is and gives you a little more details in some areas about what you'll be able to do in different jurisdictions. So there's a list there. There's also a list on the AAMP website, which is specialty and educational affiliates too. So if you're interested, in gaining a specialty area, those are all postgraduate, or for the most part are postgraduate. But for instance, you can become a fellow in oncology, and that's for NDs who really specialize and maybe do a lot of work with patients, with cancer patients. And that is considered one of our official specialty groups because there is a specific way that you enter into that specialty and become a fellow. So there are a few of those. We do not have the number of specialties or board certifications that allopathic physicians or osteopathic physicians do, but we do have several, and that is growing too. That has been growing over time. So if you're interested in that, please take a look at those links. Next slide. All right. So I'll talk a little bit just about the scope of practice in both Washington and California. So I suspect among our participants today, there are some of you who are looking at either campus, or maybe you're trying to decide between the campuses too. So, really, I'll start by saying that the curriculum is identical. And so that is advantageous for a lot of reasons as a student. One is you generally know that the expectations and the outcomes are going to be the same no matter which campus you graduate from. Also, it allows you to transfer in between the campuses. So we have a number of students every year. As long as you're in good standing, you can transfer. And so sometimes students will do that because maybe they want to practice in the different place than where they went to school, or they just want to experience the other campus and see how it's different, or gain specific experiences there. So you can do that because it is the same curriculum on both campuses. The scope of practice, though, does vary between the two states, not drastically, but it definitely varies. And so the types of experiences that you're going to have in the clinic will be different according to the campus. Um, as well as it's always going to be different because you'll have different instructors, and it will be a different experience on each campus. But we keep the curriculum as close together as possible so that you have that adaptability, and we are meeting the outcomes that are the same for students who graduate from either campus. So you can see within the scope of practice in Washington, it's many of those lifestyle medicine type things that I mentioned, as well as physical medicine, counseling, and a fairly large prescriptive authority. Um, so we can't prescribe what's called Schedule 1 or Schedule 2, other than a couple exceptions. We can do some office procedures, administer vaccinations, and IVs. So that's our scope of practice. It is fairly broad in Washington. We are considered to be primary care physicians in many ways in Washington state. Sometimes that's a designation that really has more to do with insurance than has to do with regulation, but we generally have the rights and responsibilities that other primary care physicians have within the state of Washington. Next slide, please. So now in California, we can also provide a lot of primary care services, but we are prohibited from calling ourselves a primary care physician or a physician. You will see in the state associations, for instance, some are Association of Naturopathic Physicians, some are Association of Naturopathic Doctors, or some version of that. The difference is usually because of what we can legally call ourselves in that state. Um, it doesn't change many things, but there are some things that would change. There are some things that we are not able to do in California that we can do in Washington. One is some minor office procedures, and the other is um, uh, some physical medicine techniques. Basically, like when you go to a chiropractor and you get adjusted and you hear the crack, we cannot do that we cannot intentionally do that, I would say, in California. Now, if you're putting someone through mobility exercises and they do happen to have that crepitus and you hear the noise, that doesn't mean you're doing something wrong. It just means that you can't intentionally use high force velocity movements in that area. So you can do lots of other things as far as physical medicine, massage, stretching, soft tissue work. You just are a little bit prohibited in that area. So, and then you can prescribe non-controlled substances in California as well. Um, and we so all of those things are still kind of within the scope of practice in California. There are just some those small differences. Next slide, please. Okay, so I'll talk a little bit about or I'll just pause for a second. Um, okay. Some good questions. So I will definitely get to those. Next slide. I am going to talk a little bit about our curriculum here first. So this is our mission and vision of the ND program. Um, and what we aim to do. And there is some synergy with our university mission and vision if you have read that as well. But we really do try to not only create great naturopathic doctors, but create leaders in the field. And Bastyr, as a very small institution and a small profession, has created an outstanding number of leaders within the field. And lots of examples that we can share with that. But, for the size and the number of alumni that we have, you will see many of our alumni working in unusual places and really being trailblazers in certain areas. Um, so we're very proud of our graduates of Bastyr, and I think we are very successful in creating leaders for the profession, as well as creating really solid, good naturopathic doctors who make big differences within their communities. So, next slide, please. So, what makes our program unique? Oh, it went forward a
Sorry.
couple. Yeah, that's okay. What makes our program unique? So there's a couple of areas that you will see are unique to our ND program. One is and probably the biggest one that you'll see in the actual curriculum is a systems-based approach, which is your biomedical, your basic sciences, and your clinical sciences, where you will see that when you're studying, say, the respiratory system, you will be studying that in anatomy, in biochemistry, in physiology at the same time. You'll be looking at that and, finding how to palpate and like listen to the lungs at the same time that you're studying the basic science, the physiology behind that. So we use the system-based approach, and that is throughout the curriculum. So then when you get to, say, the third year and you're learning, you're reviewing systems with more of a therapeutic lens, you'll be talking about, the botanical medicines that you use for children who have respiratory conditions, as well as adults with respiratory conditions. And you'll be talking about the diet and nutrient choices you would be using as therapeutics in respiratory conditions. So you're learning all of these things, and there's a lot of reinforcement because you're learning the systems um, with multiple subjects within the system all at once. We also have a very strong foundation in clinical theory, as I was mentioning before. That's a lot of what we do. We talk about kind of the approach and case-based courses from the very beginning of the curriculum and throughout the first, second, and third years. Um, we Bastyr has always been known for our ability to combine modern research with traditional understanding of the medicine. And so using the best of conventional approaches as well as naturopathic approaches. We have a lot of active and hybrid learning within our curriculum. So I saw that there was a question about online learning. A portion of our curriculum is delivered remotely. So it's not always what people traditionally think of as online courses, where kind of like it's opened up and you're on your own and you finish the course at your own pace. It's not like that. It's very paced if we do have online learning, where there's usually a component where you meet sometime during the week, as well as may have some online learning activities. So that's really more hybrid learning than strictly online. Um, we also have a lot of things face to face still, because you certainly can't really effectively learn how to, palpate a liver um, in, a totally virtual setting. So you learn how to do exams and laboratories and certain therapeutics are all still going to be in person. Clinic is also in person. So we definitely do telehealth because everybody in medicine does telehealth now. But a large percentage of what you do is still in person in our clinic. And then, what also makes our program unique is the deep history, particularly in the Seattle area of naturopathic medicine and many practicing NDs in this area. And in the San Diego area, we have quite a number of leading institutions in integrative medicine and a growing ND community. So that, like I said, there's a kind of a slight, difference in your clinical experience, and sometimes that's because of the external environment where your campus might be. Next slide, please. So we begin clinical training in the first year, and that continues throughout your program. We have a number of external clinic sites as well, where you can participate in community clinics. We have some specialty shifts where you can also participate as part of your clinical experience. So that is also something that might not be found in all ND programs, but it is a part of ours. The other area that is unique in making our program unique is the ability to gain a second credential. The ones right now that we have available are acupuncture and East Asian medicine in Washington, counseling and health psychology in Washington and California, and functional medicine certificate in California and Washington. As well as we have some curriculum concentrations that you can engage in Washington as well. So there was a question also about functional medicine, so I'll mention it here. Functional medicine does have a lot of overlap with naturopathic philosophy, but it is its own approach. Um, Functional medicine practitioners are not necessarily naturopathic physicians as well. You can be a functional medicine practitioner and be a nurse practitioner or a counselor or a nutritionist. Um, so we don't do exactly what functional medicine specialists do. However, there is some overlap in the types of therapies and in the general patient approach. But it is its own system. It has its own philosophy and framework. Um, and that is why we are now offering the certificate in functional medicine for students who want to gain both perspectives. Next slide. And of ours. Okay, so here's a little bit on the program outcomes. I'm not going to read through those, but I will highlight the main one is really for you to come out as a safe and effective naturopathic physician. So you have to have competency in both biomedical sciences and clinical sciences and patient care to be able to do that. And we really place a large emphasis on that safe and effective care. In your clinical experience, we are always very patient centered. That's kind of naturally a part of naturopathic approach. But, we also do provide a good perspective and an overview of different types of approaches in medicine. So, for instance, some of your supervisors will likely gravitate towards a certain modality or are likely to see a lot of patients within a particular population or with a specific condition. So that is also you also will have exposure to that during your clinical training as well. So I think that's it for all of mine.
Dr. Connor, thank you so much for that information. Really appreciate it. So,
You're welcome.
to the 61 participants, thank you so much for these questions that you're answering. So keep them coming. I have the admissions part of the presentation, and so I'll be doing that. And then Dr. Connor will be able to answer your questions. So please keep them coming. As a reminder, you will receive this video presentation and also to the slide deck as a thank you, just for your notes, so you can re-review, um, and it will be sent to your email. So just be on the lookout for that. So let's get started with the admissions part of our presentation today. I get the question asked quite a bit. So what makes a strong application? Well, here you go. Let's find out. Um, Here are the application requirements for the ND program. Our students are expected to have a bachelor's degree with a 3.0 or above, and then satisfy all the completion of the prerequisites. There's 9 science prerequisites. I'll get to that in a few slides here, but some dates that I just want you to be mindful of. The application for fall 2026 and also to winter, excuse me, winter 2026 is now open. So if you're interested in those two start dates, you definitely have access to the application. Feel free to meet with an admissions advisor, and we will definitely help you out with that. You'll see here the deadlines um, for the Honors to Entrance Scholarship is September 30th. What that is that's a Bastyr University Merit Scholarship. It's a one-time scholarship, anywhere from $1,000 to $5,000 based off of prerequisite cumulative GPA. So if you want to qualify for that scholarship for the winter start date, which starts January 12th, make sure that you get your application in by September 30th. We have a hard deadline of December 15th for the 2026 application. So if you want to qualify for that and get an interview, make sure that you get your application in before December 15th. And like I said, for both campuses, San Diego and Seattle, we have the winter start that starts January 12th, 2026, right after the new year, get your new year started right on track, getting in school. So looking forward to helping you out with that. Want to just get into a little bit of the details. There is an essay where you'll be able to put this information, whether it's volunteer experience, things like that. There's an essay piece of the part of the application where you'll be able to talk about your experience in healthcare, your exposure to the practice of naturopathic medicine. So that's where you'll be able to communicate where you have those skills. So all of our students are on, case by case. We review all students on a case by case. So if you need help with the application, feel free to reach out to an admissions advisor, or also too, you have access to the application right now. So you don't have to wait until you have an advising appointment. Feel free to just get in there right now, see what it looks like, see what we're looking for, official transcripts, the essay, all easy things to do. And if you need help with any of that, feel free to reach out to your admissions advisor, admissions team. Okay, like I mentioned earlier, the science prerequisites, 9 in total. So let's get into the details of these. Chemistry 1 and 2, biology 1 and 2, organic chemistry 1 and 2. All of these courses need to have labs. So just be mindful of that. For the biology 2 course, um, it needs to cover cells and genetics. We will take a biology 2. We'll take anatomy physiology. We'll take a microbiology, also to a botany course. So if you have one of those courses, we can accept that for biology too. Organic chemistry 2, cut and dry, or biochemistry 300 level or above will qualify for the one of those 2 courses can qualify for the organic chemistry 2 requirement. Physics needs to be algebra or calculus base. There's no labs for that. An intro to psychology, and then college level algebra, pre-calculus, calculus, or statistics. One of those four can be accepted for the math credit. And so, yeah, you'll see there recommended. I got into those courses there. So for a more detailed description, set up an advising appointment. We'd love to get into the weeds, so to speak, of of your courses, your prerequisites that you're taking, and help you sort through that. If you are looking for some online courses, down here at the bottom here, Straighterline is a really good resource for and those biology and chemistry courses. I don't know if they have organic chemistry. I haven't seen those. Oh, what I was going to say, biology, chemistry, physics, psychology, college algebra. They do have all of those. Feel free to go to Straighterline. And then there is a Bastyr University link in the main page when you go to the colleges section of that website, and you can find a list of those courses that we accept from Straighterline. Okay, 3 steps to apply. Number one, apply when you're ready to submit your application. You'll go online to apply at .bastyr.edu. You can also get to our application through our website, so bastyr.edu. You're going to need to request all of your official transcripts. And we highlighted the all because what tends on happening is some students have this one course from 15 years ago. We definitely need that transcript. So I know it's listed probably some more times than none that it's listed on your main um your degree where you received your undergrad degree, but that does come up from time to time. So just be mindful of that, that whether it's one course or a whole degree, conferred degree, make sure that we get all of your transcripts. You'll send those transcripts to appstat@bastyr.edu. We need official transcripts. We can take an application and go through um, the application process with unofficial transcripts, and we can also to offer you an interview. But we will need, before you start the program, we will need all official transcripts. And some students, more times than none, have courses that are in progress while they're applying to the program or are admitted to the program, and they still have some courses to complete. So just keep in contact with your admissions advisor when those grades come in. Send them in as soon as possible so we can update your file with all the current grades. Um, Here it says your $75 application fee is waived by attending this webinar. So we wanted to say thank you for your time and attention. And so you'll go through the application process. You'll fill out all of your information and just let your advisor know that you attended this webinar, so you can get credit for the waived application fee. And then, of course, number 3 there, check your email regularly for application updates. What we mean by that, missing transcripts, like I mentioned before, interview dates, especially for the ND program, you want to get in for that too as well. And then also too, if you received a scholarship. So sometimes what'll end up happening is the email address that the students have given us, some things will go to junk mail or your spam box. So just be mindful to check all your boxes just to make sure that you're getting the communications. It's getting sent directly to the updated box. So just be mindful of that. What's next? Okay, here let's start with number 1. After your application has been submitted and all documents, it'll be evaluated by our admissions committee. Strong applicants will be invited to the interview. Dr. Connor is the head of that. All right. And then if you're admitted to the program, the next steps will include a financial aid appointment and then the financial aid meeting. We'll go into the details of financial aid in the next slide. You'll pay your enrollment commitment deposit, and that's a $200 deposit that will get credited toward your tuition. Also, too, you'll set up your Bastyr University email and student account. And all of these in box 3 here, you will receive, once admitted to the program, you'll receive steps on what to do next, along with a follow-up with your admissions advisor. And so just the regular communication that you need to see to help you move forward. And just remember, set notes for yourself. Any final transcripts, any remaining grades, you want to make sure that you get them in and make sure you get a confirmation that they're in from your admissions advisor that we've received them, that your grades have been up to date, and that you have a complete and ready to go application. Okay, so financing your education. A lot of students ask, how am I going to pay for this? And I'm sure that's of interest to everyone here. So being prepared to successfully finance your education is critical. So we want to do all of that front end work. And how do we do that here? We'll see here. Most students that apply to our program will use financial aid, federal financial aid through the FAFSA. The 2025-2026 FAFSA is still open. You'll go to FAFSA.gov. Make sure that you will update update your application with the school code right here. And then also too, there's a separate application for the FAFSA. This is a Bastyr University financial aid application, and it's still open for 2025-2026. So you want to submit those documents as soon as possible. I've seen a lot of students that enter this program. They have their financial aid information already done before they start their application. So nothing wrong with taking the initiative. If you're that, excited, ready to go, you're more than welcome to just take a look at that or get started with all of that information. The sooner you get started with this, the better off you're going to be. Also, too, be mindful to provide any other requested documents. We have a wide variety of students from students that are just getting out of undergrad, working students with working families, veterans, and so from students that also too have green cards. There's a variety of different backgrounds and situations. So it's not a one size fits all. So in order to get the best possible understanding of what your financial aid picture, would look like, always important, set up a financial aid appointment, or we also too have a financial aid website where you can get general questions answered. So do your due diligence on the front end and make sure that you are able to provide any other requested documents. My director wanted me to also to highlight and just make you aware a lot of things that are going on with financial aid today in the news. Bastyr University is currently monitoring the situation and just what's going on with the state of financial aid. We are an advocate for our students and their financial aid outcomes. Any adjustments, anything that you need to be made aware of, we will make sure that we communicate all of that information to you, that you are informed by making when you make your decision in regards to your funding, your funding here at our school. So anything that changes, any updates, we'll make sure that you know. So, okay. Okay, we have a financial aid team. Chris is our Indie advisor for all your financial aid questions. I've been working with Chris. I can vouch for him. I've been working with Chris for about 10 years. He is a great resource, a great person to get all of your questions asked. There's nothing he hasn't seen. Feel free to email or call him for all of your very detailed financial aid questions. We also too have a general email box, finaid@bastyr.edu. If you need to upload, this is important. If you need to upload any of the requested documents, or just also to a general email box, you can use these 2 resources to get all of that information, and they will take that and also to point you in the right direction if they need anything else. Okay, like I mentioned earlier, when you're ready to apply to our program, this is our financial aid team. You see there me, we have Carrie, John, and Delania, and Dr. Connor. If you have any questions for Dr. Connor on the back end, feel free. Her contact information is located at the bottom there. Um, I'm located in San Diego, and we have reps located. We will have we have reps located at the Washington location. We will meet you virtually on location at open house anywhere. You let us know where you'll be. We'll be there just to get your questions answered and help you to move in the right direction. But this is our team right here, and we would love to help you out. So there's some names here that you might already be familiar with. If not, I'm here at the San Diego location, Carrie's at Washington. Feel free to contact us if you need anything. But we're here to help. So I'm going to stop right here. Dr. Connor, how's those questions going? Any admissions, things that you want me to get answered or?
Yeah, there's a few prereq ones that you can
Okay.
probably
Okay.
answer
Yeah.
in there. I answered some of the easier ones, but there's a few that I did want to answer
Okay. All
because
right.
they might be a little more involved. So
Yeah.
if everyone's still okay with hanging
Oh,
on.
yeah. Okay. I get.
Um, so one is the difference between naturopathic medicine and osteopathic medicine. So um, that is so there's a number of things. I mean, obviously the philosophy is different. There is some overlap in some of the treatments that we learned. However, osteopathic physicians don't generally learn as much nutrition or herbal medicine as we do. Um, the approach is definitely different. Osteopathic physicians, are required to complete residencies. I did answer a question about residencies also. um, Residencies in general are not required to be licensed in any states, although some graduates do complete them. And probably one of the biggest differences I think between DOs and NDs is we do not train in hospital settings. So we train in outpatient settings, and uh, rarely, you might get a opportunity to train in a hospital, but it's not a standard part of our training. And we don't have the number of specialties that are available to allopathic or osteopathic physicians, like I mentioned before. So,
Okay.
um,
I've got some that I can answer. Okay.
yeah,
Is that okay? Before
yeah,
you,
yeah. Go
yeah.
ahead.
I see here, how recent do the required classes need to be complete? For biology, chemistry, organic chemistry, there is a 7-year window on those courses. Psychology, pre-calculus, or psychology, math, and then physics can be outside of the 7-year window. For those biology, chemistry, and organic chemistry course, please don't count yourself out if you're outside of the 7-year window. Why don't you send us over your transcripts? What we can do is we can take a look at them. More times than none, I send them over to Dr. Connor. She takes a look at them and she gives me the recommendation, and I can send that back to you. So if you have courses outside of that window, um, um, please send us over your transcripts. let's do an advising appointment to really give you a good assessment of where you're at with those courses. Does that sound right, Dr. Connor?
Mm-hmm. Yep.
Okay. And then I see here, do I need to take lab classes in person or they can be completed online? We do accept online lab courses, but before we say yes to those, why don't you send us over the course description? All right, we're going to bring in Dr. Connor, make sure that that is the appropriate lab, that it has the right information in, and then we'll send you back either that will work or maybe a recommendation for something else. So, yeah.
I
Okay.
think there's another one here that I can answer if you want
Okay.
to. Um, so, great question. The experience and how the job affects one physically. Someone with a chronic condition who's wondering if it's going to be hard on their body. And I'll kind of combine this with one of the other questions too. But one of the beauties I think of naturopathic practice is there's a lot of adaptability. There's a lot of different ways that you can practice. We have physical medicine specialists who practice very much like a chiropractor, I would say, or maybe a PT or something. And then we have folks who strictly do, nutritional supplementation and nutritional counseling, and kind of everything in between. So I think if you're looking for something that allows you to continue to see patients, work in the healthcare field, and really create your own pathway for the way that you want to see patients in the future, we have a lot of tools for you to be able to do that. And it is very adaptable, I think, to circumstances and to um, you know different interests and and things like that. So there's a lot of flexibility there. And to wrap this in, because someone had asked about jobs besides owning your own clinic, like I said, it's very adaptable, and many people with the naturopathic doctor degree go on and do things that are not necessarily clinical. So, still, the majority of our graduates practice, or at least practice part of their time, but they may also teach, they may be involved in research, they may be involved with, kind of more corporate wellness, things like that. Um, so there's different ways that you can use the degree as well. You don't necessarily have to go into private practice, although that's still most of our graduates do that as part of what they do. So. And as far as the job market, there's uh, increasing abilities to kind of use your degree for different jobs. But again, most people are still either opening their own practice, joining a practice, becoming an independent contractor of some sort or a health consultant. Um, so it is good for people who do have more of an entrepreneurial spirit if that's the way you're going to use your degree. So
So, Dr. Connor, we have to wrap it up. I think we went a little bit over today, but for the attendees and the participants today, these are all really good questions. And if we didn't get your questions answered, it's okay. Feel free to email us or also to Dr. Connor, and we will definitely follow up with you to close the loop on your questions, help you with the decision-making process. But we want to thank everyone. We had about 60 participants here tonight, so just an awesome group with really great questions. Thank you, everybody, for attending, and keep in touch with us, set up an appointment, and looking forward to working with you here at Bastyr. You guys have a great night.
thank you all.
Thank you, Dr. Connor. Thanks, Mark. Yeah. Was it good? Good. All right.
Great job.
All right.